Morning. I would like to present 3 cases of stent graft castor implantation. Uh, Piotr Gutowski, Arkadiusz Kazimierczak, Paweł Rynio from Pomeranian University from Szczecin. This is our disclosures. Nothing to disclose. What is this castor? This is branched aortic stent graft system. Is the product manufactured by Shanghai Microport and Vascular MedTech in China. This is new device. I think that for everybody, so that was first implantation out of China. Up to date, castor is custom made because the anatomy of left subclavian artery varies. This is philosophy of company. To date, this is only available facility, so we have to order specially for certain patient. Presented cases are first, as I said, castor stent graft implanted out of China. We got experience with 3 patients. First patient, aortic dissection type B, Stanford, 50 years old male. Second patient, aortic dissection type B, Stanford, male, 50 years old. Is a little bit similar to the first. And the third, young lady, after injury of thoracic aorta during car accident, 24 years old female. First implantation, that was any problem. We implant, of course, that was first time. We prepare very certainly to this implantation, but there is no any problem. That was very smooth, perform all procedures. Patient number 2, there is no any problems as well. We attempt the femoral arteries by puncture, so that was closed with proglides. I think that this is possible, but the problems revealed with third patient. After stent graft deployment, we observe absence of flow in left subclavian branch, red arrow indicate, contrast injected from brachial artery. And we think what we have to do with this. And after PTA, we decide for PTA with balloon 5 millimeters, subclavian branch after this procedure is parted. Probably sometimes it's necessary to support something from inside the lumen of the branch. Possible problems during implantation. What is possible? We have to pay special attention, require possible subclavian branch guide wire twisting. This is possible, and company indicate that we have to be aware of this problem. If we know about this, I think we can avoid such situation. We got, of course, few recommended ways how to avoid this, how to solve the problem. Method 1, method 2. This is, of course, possible. If you start to implant this stent graft, I think you will be interested very certainly how to avoid this. What is the principal advantage of castor stent graft? Unibody design eliminates the risk of endoleak and migration. This is most important feature of the stent graft. The branched stent graft is the most recommended strategy, which can avoid gutter endoleak from parallel graft or technique. Comparing with in situ fenestration, branched stent graft can assure the precise placement. simplify procedure, and shorten operating time. In our situation, in our conditions, that takes 1 to 1.5 hour procedure. So I think that is relatively quick. It is responsible treating strategy to reconstruct branch with a standard operation procedure, especially if we take into consideration that 30 to 40 of TVAR required covering of zone 2 with left subclavian artery. Our conclusions, our remarks. Generally, castor stent graft is surgeon-friendly. Special attention requires possible twisting of guide wire. Outer size of stent graft application system, frankly said, should be smaller. Subclavian branch markers could be better visible. Brachial attempt due to size of branch cap locker require 9 French introducer. And the final, most important, I am very happy we eventually have tool to fix troublesome pathology of aorta. Thank you for your attention.